Okay, well, welcome. Welcome to this month's Wisdom Wednesdays, sponsored by and hosted by the African American Employee Resource Group and co-sponsored by Extension's Office of Access, Inclusion, and Compliance and the Human Development and Relationships Institute. I would like to take a moment to reflect on this month in Black history. Juneteenth is a celebration marking an end to slavery in the United States. Though Abraham Lincoln issued the Emancipation Proclamation on January the 1st, 1863, very few people were immediately freed. A full 2.5 years after the Emancipation Proclamation and 2 long months after Richmond fell, the last enslaved African Americans in Texas were pronounced free people. That momentous date, June 19th, 1865, has been proclaimed Juneteenth and celebrated annually ever since. Ironically, or perhaps not so, in 2020, Austin, the state's capital, city council officially established Juneteenth as a city holiday. And just yesterday, Galveston, the birthplace of Juneteenth, recognized the day as an official city holiday. If you would like to learn more, please visit our AAERG SharePoint site and click on our calendar. I'm Danielle Hairston-Green, Institute Director of Human Development and Relationships, Chairperson for the African American Employee Resource Group, and District 530 Representative for the Academic Staff Council with UW-Madison. Thank you for sharing your lunch hour with the African American Employee Resource Group, affectionately known as AAERG. As we continue to engage you in meaningful dialogue during our Wisdom Wednesday series. The AAERG purpose is to serve as a resource for and foster current and future African American colleagues' success by sponsoring programming, providing collegial support, encouraging belonging, and raising a collective voice related to issues that impact employees' ability to thrive personally and professionally. We would love your feedback and we'll provide a link to a survey in the chat box as we close out this session. I would like to first acknowledge our committee members, Dondieneita, Fleary, Simmons, who's the co-chair of the Professional Development Committee also, Rick Mills, the secretary and members and events committee, Eva Terry, the treasurer, James Bowling, retention and recruitment committee chair, Catherine Boris-Smock, our chairperson as of the middle of June for membership and events, and Jerry Bratz, our historian. I'm super excited to introduce to you our June presenter. Dr. Maya Rockeymoore-Cummings is an insightful strategist whose vast network and rich professional experiences working across the public, private, academic, and nonprofit sectors bolster her ability to identify emerging trends and make critical connections between complex social, economic, political, and technological phenomena. Dr. Rockeymoore-Cummings is the founder, president, and CEO of Global Policy Solutions, LLC, a strategy firm that helps corporate, philanthropic, governmental, and nonprofit clients meet their strategic objectives. She is also the immediate past board chair of the National Association of Counties Financial Services Corporation and has served on a number of nonprofit boards, including the National Committee to Preserve Social Security and Medicare, past board chair, National Academy of Social Insurance, National Council on Aging, and Baltimore Museum of Art. Dr. Rockeymoore-Cummings has more than a quarter century working on innovative public policy and multi-million-dollar social change initiatives. She directed the strategy to elevate closing the racial wealth gap on the national policy agenda, led a multi-million-dollar initiative to reverse childhood obesity and promote healthy communities, was at the forefront of efforts to strengthen and expand Social Security, and was the architect of the first ever study examining the impact of Level 5 autonomous vehicle technology on the US labor market. A dynamic strategist, analyst, and advisor with a talent for visioning and agenda articulation and implementation, Dr. Rockeymoore-Cummings is also an accomplished speaker and author who effectively communicates ideas to experts and lay audiences. She has testified before both houses of the US Congress and spoken at events sponsored by numerous organizations such as the Centers for Disease Control and Prevention, the Robert Wood Johnson Foundation, NASDAQ, to name only a few. Her quotes and articles have been featured in publications such as the New York Times, Washington Post, The Atlanta, and Wired.com. She has appeared on MSNBC, CNN, ABC, CBS, Fox News, and NPR, among many other outlets. The recipient of numerous honors and awards, including the Aspen Institute Henry Crown Fellowship, Purdue University Alumni Association 40 Under 40 Award, and the Congressional Black Caucus Foundation Congressional Fellowship. Dr. Rockeymoore-Cummings earned her bachelor's in political science from one of my alma maters, Prairie View A&M University, and her MA and PhD in political science with an emphasis in public policy from Purdue University. To review her full bio, please visit the Aaerg SharePoint site. Without further ado, I would like to introduce to you Dr. Maya Rockeymoore-Cummings.
Thank you, Dr. Hairston-Green, and thank you, Dondieneita, for pulling all of this together. I certainly appreciate everything that the University of Wisconsin-Madison African American Employee Resource Group is doing to not just, build community amongst the African American group of employees, but to also build capacity amongst the larger extension, family. And so with that, I just want to tell everyone who took the time out of their precious day to spend their lunch hour with me, I just deeply appreciate every single one of you. I'd like to start by just giving you a little bit of background about myself so that you can understand my point of view and why I, do the work that I do. I am the fourth generation from slavery in this country. My parents and their parents grew up in the Jim Crow South. They lived in my parents were childhood sweethearts living next door to each other. And so, they came from a small town and, my brother, sister, and I grew up with stories of them telling us what it was like to grow up in a separate and unequal context where the laws of the land and the practices of the land actually forced them to go to separate and unequal schools, to not be able to sit anywhere they wanted in a movie theater, for example. The kids they want to be able to sit wherever they want in a movie theater, but they had to be in the designated Negro only section, to actually have to drink out of Negro only water fountains, and certainly not being able to go into any store that they wanted to. And as you all well know, with the civil rights movement, all of those formal ways of keeping Blacks and whites and other people of color separate in our society fell away. But unfortunately, what did not fall away were the stereotypes and the attitudes that informed the official policies of segregation. And so, more than, we're coming up on Juneteenth, I'm actually from Texas, which is ironic. And I recall, growing up in the summer times, going to visit my grandparents and celebrating Juneteenth. I didn't realize the significance of it until later. But, my life and that of my brother and sister and I were very different from that of my parents because, my dad went into the US military. And the US military was integrated in 1948 under Dwight D. Eisenhower. And so my life and my perspective on the world was very different because I'm the first generation in my family to attend integrated schools. It was nothing to live next door to, white people or Latino family or a mixed race family or an Asian American family or a family that had Arab American roots, or a family that, basically had different religious traditions. That is what the US military is. And I've got to tell you, living on and around military bases in my formative years taught me to love this country, the United States of America, in all of its forms and aspects. And so even though I was very aware because my parents taught us what the history of this country was, and they made sure that we had access to books and that, that we were educated about, what it was like to grow up in a separate and unequal society. I've seen the promise of this country as well. And I see how Blacks and whites and people of all backgrounds can live together and work together and love together towards a better future and in support of this country. And so despite everything that we see going around us right now, going on around us, the divisiveness in our political system, certainly, you know, the notion that some people believe that this is still a country that's whites only, the notion that some people believe that, you know, Blacks are an inferior beings or Latinos are inferior beings. You know, the fact of the matter is that this is all boils down to valuing our common humanity, despite our differences, and even because of our differences. Let's celebrate that and love each other. And so I'm starting with this picture of this beautiful mixed race couple that I took this picture. I'm so proud of it. It's my best picture ever, I think. And they were at a protest that happened here in Baltimore a couple of years ago. And I asked them if I could take their photo. And they said, absolutely. And so, you know, you can see here that, you know, this is the reality of love beyond boundaries, of not thinking about people in categories and stereotypes, but thinking about people as people and embracing and loving them and each other on the level of our common humanity. And that little girl just proudly saying, my life matters. Yes, it does. Your life absolutely does matter. But when you look at the statistics, when you look at the practices that are happening around our country, and it's not just Wisconsin, it's in every state across the land, we continue to see the vestiges of, unfortunately, structural racism in this country and the patterns that are driven by a value system that think that some people are separate and unequal, that should be separate and unequal. And so with that, you know, I'm very proud to talk to you about some of the work that I've been doing over the past 20 plus years around how do we drive a society toward inclusion? How do we drive a society towards embracing the concept that we are all worthy and all of our kids are worthy of living our best lives and that we can do better than we've done in the past? That if we take the perspective that this is not a zero-sum game, us against them, you against me, Black against white, brown against, you know, yellow, that we can get toward a society where all of our children have the ability to thrive and to live their best lives, and that our country can thrive, that we are taking all of our talent off the table and activating it, putting it to work and to use for the well-being of our entire enterprise. And so what that has led me to is work around public policy, practice and programs that focus specifically on health, wealth, and I've done some education and technology work as well. And so, you know, with that, I think that you should know that for, you know, we talk about income a lot. And certainly income is important for families across the country. It's important for economic security. And yet, you know, when you're looking at the statistics on income, we see that, you know, white men make the most in this country, followed by, you know, you can go down the list. At the very bottom of the list of who does not earn of comparable people are Black and Latino women. So there is an element of gender in here, and it's called intersectionality, that when you correlate gender and race, particularly for women, and overlay it onto systems like the labor market, you see who's valued and who's not. And unfortunately, for every dollar earned by white men in this country, Black and Latino women earn only 68 cents. Now I start with income because usually it's income that determines, you know, whether or not you're able to earn enough, not just to meet your basic living expenses, but to have enough left over to do other things with it, whether that's investing in, you know, in pastimes that you love to do, you know, hobbies, but also investing period in building wealth, whether that's, you know, in stocks and bonds or building a business or savings or, you know, certainly buying a home and building equity in a home. And the reason important for us to understand wealth is because, you know, for people of color especially who are tragically still earning less in the labor market, it is harder for them to build wealth because they have less extra money left over in order to make those investments and to have those savings. And so, you know, I have embarked on a series. I was responsible for helping to uplift this issue of the racial wealth gap on the national agenda. It was a multi-million-dollar initiative of the Ford Foundation that I co-led for a number of years. And I want to just get into the nitty-gritty about why wealth, in addition to income, matters. And as we well know, what one owns minus what one owes is actually what's left over, right? So you take away your debt from what you have, and then what's left over is your wealth. And they're called assets, you know, things like real estate, stocks, bonds, savings, and pension. And they're different, distinctly different. Wealth is distinctly different from income because, you know, income is what you earn primarily through your wages. But, you know, it could be what you earn through rents and interest as well. But, you know, income is distinctly different from wealth because wealth tends to be the assets that are left over beyond what's above and beyond income. And it's important because it provides economic stability for families, particularly in times of economic distress. So if you're a person that only has income and you're living paycheck to paycheck, and heaven forbid, like something that would happen to a lot of families during the COVID economic crisis, you know, you lose your job, or the 2008 economic crisis, you lose your job, and all of a sudden your income is gone. And when your income is gone, what do you have to fall back on? Well, it turns out the data in our society shows that, you know, unfortunately, Black and Brown Americans have less, dramatically less to fall back on. And that white Americans tend to have more to fall back on, a cushion, if you will. Wealth provides that cushion. But, you know, there is a historical aspect to wealth as well as a contemporary aspect to wealth, because usually how much you actually have in assets and wealth or what the assets are tend to be compounded throughout time, meaning that you inherited perhaps from your family a home. You inherited perhaps an inheritance, a cash inheritance when somebody passed away, or an insurance inheritance when somebody passed away. And then you were able to take that wealth that was passed down to you and either put it to your own use or transfer it into another form of asset that has helped to bolster your family over time, and so on and so on. As many people know, there is compounded interest associated with wealth. That when you have, like, say you bought a home in downtown, you know, for example, I don't know, Washington, D.C. You know, your parents bought a home 50 years ago. They passed it on to you. That home that they bought 50 years ago for $60,000 is now worth $1 million. And so that's the compounded value of that wealth building over time. The same thing with cash and stock assets. They tend to compound over time. And so when you have wealth being passed down through families, that is the advantage, the wealth advantage that white Americans actually have over Americans of color. And so that's typically the difference in the prosperity that we see between families, in addition to the racial wage gap. But unfortunately, we have a history where discriminatory policies and practices in our society have played also a role in creating significant wealth gaps between racial and ethnic groups. And so, you know, not to belabor the point, but, you know, I start with the fact that my great-grandparents, that my great-grandparents, not great-grandparents, were slaves as children, because slavery was a policy. It was a practice and it was a policy of the land here in the United States. And the reason why that matters is that it was a policy that officially said that people of a certain skin color, Black people, were unable to own anything. And anything that they produced from their own labor had to go to the white people who owned them. That is wealth stripping of a gross kind, meaning that there were very few Black people under the system of slavery who had any wealth, any assets, any income. And it was by law and by custom and practice, which means that historically we have created through policy and practice a whole situation where an entire group of people started out with zero. They started out with zero, while families that looked differently from them were able to build wealth off of them. And the country itself was able to build wealth off of the backs of people who worked the land. But also, you know, basically setting African Americans behind dramatically. So once slavery ended, you know, we talk about Juneteenth 2 years later for those in Texas. You know, once slavery ended, the fact of the matter is that these folks, you know, they were out there with nothing. And the US government said, well, we recognize you have nothing, so we're going to give you 40 acres and a mule. And unfortunately, the regressive forces in society, those who had actually proven traitorous towards the United States of America and fought against the United States for the Confederacy, launched a multi-generational effort to prevent African Americans from getting any kind of leg up in our society. They rescinded the Reconstruction policies that were proposed. The 40 acres and a mule never happened. You know, there was an effort to try to build Negro-only schools, and that took off to some extent. But, you know, it petered out because of the opposition against it. There was, for a time after slavery, an opportunity for African Americans to participate by voting in our society, and even running for office and becoming elected. And so right after slavery ended, that period we call Reconstruction, there were a number of members of Congress and state legislators, you know, not a whole lot, but some who were African American. By the end of the 1800s, they had all disappeared because of that backlash. Some people call it a white lash from those who were resentful and wanted to prevent African Americans from actually gaining a foothold in this country. And so we have seen these discriminatory policies and practices playing out in various ways, but get this, on the converse, you know, so we've had regressive and anti-Black policies in our history, but we've also had pro-white policies, meaning that we have been willing to use the tools of government and the resources of government to build the wealth of whites over that of Blacks and brown people. And you say, why? How is that, Maya? There were policies like the Homestead Act. The Homestead Act encouraged, you know, Americans to go west. And the federal government guaranteed that, you know, if you go west and settle the West, you know, we'll provide you with attractive land and support to build homes so that, you know, we can have, you know, you all know the concept of manifest destiny, but basically, the Homestead Act helped to fuel the American expansion throughout the North American continent. And so with that, you know, it was a whites only policy. Blacks and brown people need not apply. And so that was one instance of the federal government using the resources, the tax resources of the nation, to specifically help to build the wealth of white people. Another instance, interestingly enough, there are two more I'll cover. There are a lot, by the way, not just these three, but there are a lot of policies that were structured in that way. But two more I'll mention was the original GI Bill. When it was passed, the law didn't specifically say this is only for whites, but they actually allowed the states to actually implement the GI Bill. And the states that were, that had people in it who were, you know, had racialized, some would say racist values, basically implemented it in a way where Black and brown people were not soldiers, not people, soldiers who had fought for their country. Were not able to actually get the benefits of the initial GI Bill. Same thing with Social Security. Interestingly enough, when the Social Security Bill was passed in 1935, on its face, it looked race neutral. You know, there was nothing in it about Black or brown. But what they did is they used a tool. They said that this policy is going to apply to all workers except for workers who are domestic workers, meaning maids and butlers, and except for farm workers, anybody tilling the fields. And guess what? At that point in time, 65% of all African Americans were domestic and farm workers. And so in the initial implementation of the Social Security bill, the benefits went strictly to whites and not to Blacks. And so that's just a brief overview of how policy has been used in the past in order to build white economic security at the expense of Black and brown economic security. And there are more instances like that, unfortunately. So with that, today what we have is basically a big racial wealth gap. The median wealth of white households is 16 times, actually the estimates are 16 to 20 times more than African American households, and certainly 14 to 16 times more than Latino households. When you break that down further, the newest numbers that I've seen is that for every dollar of wealth held by the typical white family in this country, the typical African American family owns just a little bit more than 5 cents. And the typical Latino family just a little bit, almost 7 cents. And that is a travesty. And it's directly as a result of the things that I've been discussing with you today. And if you look at this, this is a hard slide to actually kind of comprehend. So I'm going to walk you through it. What this slide shows is the white value does not show up on this slide. What you see is Black to white and Hispanic to white. The white 100% is you see the small thin line under it says figure 1 ratio of Black and Hispanic median net worth by income quintile. Just imagine that small thin line being the white line, basically, okay? So that means that where you see the total household monthly income at the bottom, and we start over on your far right, it says 7,000 or more in terms of monthly income. That's the wealthiest class. You see that that African Americans only have 43% of the wealth of white people. And Hispanic Americans only have 34% of the wealth of white people. Let me just read this a little bit differently. So of the wealthy people, of wealthy Black and Latino people, only 43% of high net worth Black people have as much wealth as white people, and only 34% of high net worth Latino people have as much wealth. The Latino people who are high net worth only have 34% of the wealth of whites. And then you see that the racial wealth gap literally exists at every income level, but it's the greatest at the lowest income levels. Now, the reason why I'm pointing this out, so it says where it says less than 1,540, that you see that that 7% of low income, that low income Latinos have 7% of the wealth of white people, but that Black people have 0%, who are low income, have 0% of the wealth of low income whites, okay? So let me just restate that because, I need to make sure we're clear. For the lowest income quintile, low-income Latinos have only 7% of the wealth of low-income white people, and low-income Black people have 0% of the wealth of low-income white people. Now, why does this matter? It matters because a lot of people say, well, poverty is poverty. What's the difference here? Why are we even talking about the racial wealth gap when it comes to poor people? And what this data shows is that even poor whites have dramatically more than poor Black and brown people, which means that even poor whites have something, whether it's a house, whether it's something that's of asset worth of value to actually lean on in tough times, whereas Black and brown people have dramatically less to lean on, and African Americans absolutely nothing who are low income. And so that means that there is a tangible and material difference in the lived experience of poor people in this country because of the wealth gap. And we need to understand that that's important. Okay, so You know, put another way, when you add gender in there, it, you know, gets even more, you know, dramatic. You know, you see that the racial wealth gap for married folks, you know, is extremely dramatic based on whether you're white, Black, or Hispanic. You see that whites who are married tend to have more economic security than Blacks and Hispanics. For single men, it holds true that white single men have more economic security than Black and Hispanic men. But get this, single women, white women have more economic security in terms of wealth assets than either Hispanic and Black women. And you might be saying, well, where's the bar for Hispanic and Black women? Well, it doesn't exist because many of these women have children and many of them have zero to negative wealth, meaning that they're living in debt, not just paycheck to paycheck, but when they get a paycheck, they're paying off debt just to try to get by. And so, you know, the fact of the matter is that when you add gender to the equation, there is an even more dramatic difference in terms of economic well-being. All right, and then this plays out, you know, you find out that, you know, 67% and 71% of Black and Latino families have no cash, no bonds, no retirement accounts to live on. And if they were to, you know, have some kind of crisis, this is a real major crisis for Black and brown families. And so, you know, this is important to understand. And I just want to point this out because I developed this slide because I do think that we need to understand that assets aren't just about what individuals do in society. It's about how we are structured across our society and that we can have assets that are don't just belong to individual households, but actually assets as a nation. And so you might ask, what do you mean by that? Down there on the foundation, I argue that we have societal assets that we should never overlook. And so, you know, programs like Social Security and Medicare, and hopefully when we get to universal health care and unemployment benefits and wage protection insurance and quality public education and even citizenship. People don't tend to think of citizenship as an asset, but it is. I mean, it's an asset that not only matters for your economic well-being, but for your physical well-being in this country. And so with citizenship confers all kinds of advantages that we take for granted. And the reason why I include it in societal assets is because we have a lot of people who live in this country, particularly those of Latino origin who may have immigrated here in an undocumented fashion. And they're living in the margins of society in a way that that imperils their economic security, their physical security, and now we find out even of course, their health security because they don't have access to even, you know, kind of some of the fundamental benefits that come with citizenship, like the ability to tap into Medicaid, particularly when there are health challenges in the family or a global pandemic strikes. And so, you know, these are societal assets, and we know they seem invisible, but they're there, and we need to realize that they help to build and uplift the economic security of families. Asset building policies are important to this. So if you go to the first level of the house, you've got tax structures, you got your education policies and incentives, you got your health programs and incentives, your safety net programs and incentives, you got community development programs and incentives, you got fair and accessible legal justice systems for some and not for others. You got progressive employment policies and incentives. These policies matter. And yet so often, depending on the value orientation of the policymakers who are developing these policies, they are deployed to actually assist certain communities over others. And so we need to understand that there is a bias in our system that is evident in these policies across the board. And then you've got community assets, you've got kinship networks, you've got cultural assets, you've got community nonprofits and faith-based you know, assets like churches. In the Black community, interestingly enough, the church seems to be the wealthiest institutions that you can find. Financial and educational institutions that are community assets, and we don't need to overlook them. And then at the top of the house, then comes the individual assets, the real estate, the business, the private insurance and savings, and the checking and the retirement funds, the stocks, bonds, and mutual funds. And so this is all an asset house. This is what I call an asset house. In order for families to be able to thrive in a real, tangible way, you know, all of the elements, every level of this house, starting with the foundation and building up to the first, second level and to the rooftop, all of them need to be working for all families, not just for some, but for all families. And so I point that out because I just want you to understand that we need to be thinking beyond just individuals. We need to be thinking about policies. We need to be thinking about structure. Okay. So, you know, I have a whole, you know, if you ever care to look, there are whole policy recommendations. I will not belabor you with all the policy recommendations that we have developed to actually address the racial wealth gap. But I just want to say, as practitioners, you know, working in Wisconsin, you all need to understand that it is there, that it's there not just for wages and income, but it's there for wealth. And you need to understand that when you're looking at poverty and you're working with low-income populations. And so you need to focus on the racial wealth gap and think about asset building as an anti-poverty strategy. You know, helping small entrepreneurs, helping their businesses grow, helping to build financial education, and certainly, you know, helping to provide, you know, real estate assistance for people who are seeking to build assets for their families. Those kinds of things are important, and they're an important anti-poverty strategy, and we need to think about it like that. As I mentioned before, in terms of the asset house, it's important that we understand not just the difference between public and private assets, but the fact that they are interrelated and that they work together to help uplift communities. And so I would love for you to be for that to be a takeaway for you today. And of course, I think that you should always understand that wealth is important, and so is wage and income. And so when you're thinking about, you know, whether it's employment at your own university or it's employment generally across the state, whether somebody's working for fair wages, saying that, you know, we need to be looking at a $15 minimum wage, you know, all of these policies matter for building the economic security for families. And then lastly, I just want to say that, you know, as practitioners, that data exists for what's happening in Wisconsin. You can find out, you know, what the Wisconsin wealth gap is. You can find out what the wage and income gap is by race and ethnicity. And then once you have the data, you can build targeted strategies. And I'm going to get into this a little bit more later, the targeted strategies in order to address it. Health also matters. And so with that, you know, I just wanted to point out that we're all talking about COVID-19 because we just got out of, and actually, I don't even say we, not all of us are out because a lot of people are still not vaccinated. And yet what we saw in terms of the 600 to 900,000 deaths over the past year from COVID-19, that they disproportionately and in a very dramatic and disproportionate fashion burdened Black and brown households over, you know, certainly white households. Now, some people believe that, you know, and they have a mental outlook that says, oh, it's just because, you know, those people are unhealthy anyway. And that kind of attitude is overlooking a whole host of structural factors that have also created, not just resulted in disparities, but have created health disparities in our society. And so unfortunately, this disparity in racial disparity in COVID deaths was actually preceded. These disparities existed before COVID ever hit. And so, you know, the statistics in terms of racial and ethnic health disparities is that Black and brown people are at the bottom of every single statistic you can think of, whether it's type 2 diabetes, whether it's heart disease, whether it's stroke. You've got these families who are Black and brown, you know, faring worse across the board, whether it's obesity, faring worse, which of course, and I mentioned obesity, because obesity is tied to these other preventable chronic deaths. Or, whether it's cancer, you see the outcomes are dramatically worse for people of color in this country. And I argue in a book that I'm actually writing, and it'll be coming out early next year, that these are accidents. Unfortunately, it's actually by design. This is how our society operates, not just on a policy level, but on a community-based level in terms of how we structure our communities and how those communities are structured in a way to provide tangible assets, amenities, and benefits for some communities and not for others. And so, some people will say, well, our community is segregated not by race, but by income. You see whites in my neighborhood because, we can all afford to live in this neighborhood. Those people who live in the other neighborhood couldn't afford it, and that's why they're over there, and that's why they're living in a segregated situation. Okay, all right, you might say, okay, that's income, whatever. But the fact of the matter is that then you look at the communities and the differences in the communities, and then you wonder, okay, why are there disparities? Why do low-income neighborhoods have no grocery stores where people do not have access to quality foods? They do not have access to fresh fruits and vegetables. They do not have access to the things that will keep them healthier over a lifetime. And why are these same communities overly burdened by, fast food restaurants and restaurants perhaps, and I'm talking about the more urban context instead of the rural context. And I can talk about the rural context too, because my family comes from a rural area in Texas, and I'll be happy to discuss that. But with that, what you see are these disparities in access to basic amenities that are health promoting amenities. You also see disparities in terms of, targeted treatment. So for example, I did a lot of work for 10 years. I ran the Leadership for Healthy Communities program for the Robert Wood Johnson Foundation. And our efforts were focused on building, healthy communities, but focus definitely around obesity prevention. And through that work, we found out that, soda companies were actually targeting Black and brown kids. They were saturating them with commercials, more so than white kids. And so that you had, that kind of targeting happening from the private sector that overlaid on top of the disparities you see in terms of how the communities are built, that, unfortunately undermine the health of certain communities. So these disparities actually exist across the board. Some people talk about the social determinants of health, that, we need to be looking at the living conditions of communities. We need to be also, of course, understanding the individual aspects of what they encounter. Lifestyle, issues are important, but so are networks, working conditions, and socioeconomic status. You cannot ignore any of these factors, including educational attainment levels. Because with educational attainment comes better jobs, and with better jobs comes benefits like access to healthcare. So we need to understand that every aspect of how we structure our society is designed, and they interrelate in ways that can undermine the health of entire communities. And I realize that we're now actually entering time crunch, so I'm going to just speed up. Until the Affordable Care Act passed, we had dramatic disparities in terms of access to healthcare itself. And so, I used to go around citing a statistic back in the early 2000s that, Blacks and Latinos were only, Black and brown people were only about 30% of the US population, but they were a little over 50% of the uninsured in America. And so after the Affordable Care Act passed, get this, look at these numbers. The uninsured rates dropped quite dramatically for almost every racial and ethnic group, including white people. And white people, by the way, the fact that they're the lowest on this list meant that they had the most access before the Affordable Care Act was implemented. And the Latinos had the least access before the Affordable Care Act was implemented. But by the 2014, you saw all those numbers trending downward. And look, between Asian Americans and whites, you saw the access gap actually almost closing. And so policy matters, folks. People think that there's nothing we can do. You throw up your hands, there's nothing we can do to address these racial disparities. That's BS. There's a lot we can do. In fact, policy matters, and so does policy design, and we're going to talk about that. Look at this. This is the percentage of uninsured children by race in the same time frame. And we see that the disparities between Black and white kids actually were eliminated in terms of access to healthcare. And that every other racial group actually had a reduction in their uninsured rates. And so, you know, we need to understand that there are things that we can do. This is why policy matters. This is why politics matters too, by the way. Okay, and then equity matters. Equity matters. And I don't need to belabor the point about equity because you've probably been hearing about equity a lot lately, but realize I was on a television show not too long ago, a popular station that everybody has access to across the country. And one of the hosts argued to me that equity is racism. And I said, absolutely not. That is not true. Equity is not racism. Equity is just having a targeted strategy to actually use data to understand who's being left out, who's being left behind, who's falling below below the standard that we want all of our communities to have. And so it's getting basically digging out of any averages, getting rid of the concept of average, and looking at the data to find out who's falling behind and why. And then building targeted strategies to get everybody up to the point that you want them to get. So this is an important slide because for me, it shows the difference between equity and equality in a very clear way. You know, equality means that if you're falling behind, we're going to give you the same, you know, bench in order to reach the apple. But some people are taller and they're going to reach that apple more readily and they have the same bench. Some people are medium sized and they can't reach the apple, but, you know, we're giving them the same bench. And some people are really short and we're going to give you the same bench. You've got equality, but you can't reach the apple and you're never going to reach the apple with equality. But we want everybody in our society to get their apple because we want everybody to live a healthy life. We want everybody to actually have the economic security that their families deserve. We want everybody to have these things, not just because we want it's a good thing to do. It's because it's the best thing to do for our country. When we get to the point where everybody can get the apple, then we're getting to a point where we are setting our country up for a success, generational success for centuries. And so with that, an equity strategy means that if you're the shortest person in the group, look, you get 3 benches to stand on so you can reach the apple. If you're the medium-sized one, we're going to design a strategy to make sure that you get 2 benches in order to reach the apple. And this is what equity is, and this is the difference. And so with that, the question is, how do you basically assess vulnerability? And I'm just going to go through this quickly. What we're dealing with is marginalized populations, and they're marginalized by design. You know, we have the history of bias and bigotry. We have, you know, that bias and bigotry like feeding into, you know, putting people in different power positions and making sure that some have access and some don't. You know, and that bias and bigotry is also present in terms of our social constructions of population groups. What does that mean? Stereotypes. You know, there are notions out there that, you know, that if you're Black or brown, you're lazy. You're not quality. You're not smart. You can't do it. You're unhealthy by nature. All of that is BS. We have created a society where we have basically perpetuated these outcomes based on how we design our policies, how we've done our practices, and how we view and label people. And that is all reflected in our politics and our policies and our practices. And it's also, unfortunately, compounded by intersectionality. What do I mean by that? That if you're a low-income woman who is Black or brown, you are experiencing multiple disadvantages. And that is actually really impeding your ability to thrive. And so we need to understand that intersectionality exists in a way that creates and compounds vulnerability. And then, of course, there are things that we can do. There are equity-centered approaches. And so, you know, your job as a practitioner is to ask, where do the inequities exist in my society? That means you can't put your head in the sand. You got to look at the data. You got to look at your community. You got to identify where the inequities exist. And then you say, what are the social and environmental determinants of those inequities? Is it the school system? Is it the way the neighborhoods are designed? Is it the fact that they don't have X, Y, or Z? Is it the fact that, that the pay is lower than it should be? Looking at all of these factors to determine what that vulnerability is exactly. And what spheres of systemic marginalization are at work? Is it racism? Is it sexism? Is it classism? Is it all of the above? Which levers will best address the determinants that lead to inequities? And at what level? So are we looking at solutions that can be done at the local level or at the county level or at the state level? Are there public solutions that can be considered? What about private solutions? What about public-private solutions? And then how do we evaluate progress towards achieving equitable outcomes? So meaning that you can't just say, oh, I'm going to implement an equity strategy and not evaluate whether or not it's working. And so you need to make sure that, to know whether you're reaching benchmarks, that you're also building in levers, tools, and strategies in order to evaluate your progress towards the goal. And then finally, actually not finally, but almost finally, targeted universalism. So you might say, I'm a practitioner. I can't go out there and build strategies only for Black people, or I can't go out there and build strategies only for Native American people or only for Latino people. And I'm saying that, you don't have to. You can go and build a universal policy or a universal practice that touches everyone, but that has targeted levers within it that addresses the specific disparities that are being experienced by different population groups. And that's called targeted universalism. So you can have it on the policy level, you can also have it on the level of practice. And so what you do in terms of targeted universalism is that you target the marginalized groups. You are focused on where are the racial and class and the gender and spatial implications, and how do we address those? You make sure that you're getting input from everybody through participatory strategies. You are recognizing how different people are differently situated, and you're making the connections to the social determinants. You are promoting linked fate and collective solutions because you understand that everybody matters and that you're going to do something for everybody, and that you're prioritizing, and addressing geographic issues as well as opportunity constraints, and prioritizing equity in terms of your outcomes. Now, the Affordable Care Act did this. How so, you might say? It knew that women faced barriers to access to health insurance because of the way that private insurance companies treated women, particularly those who are childbearing. So the Affordable Care Act was a policy for everyone, but it had targeted strategies built into it that helped women. It had targeted strategies built into it that helped people of color. It had targeted strategies in it that helped small businesses because they recognize that small businesses face certain clear barriers. And so that is what you do, even on the program level. You look at how you build levers into broad policies in order to help everyone. And then finally, just in terms of a strategy for implementing equity policies or programs, you got to articulate your universal goal. What do you want everybody to achieve? What is the vision? How does it benefit all of our residents? What does it solve, and what need is it solving? 2, you're assessing the difference between the general population you assess the difference of the general population from the universal goal. So how does the status of the general population differ from the universal goal? You're looking at data analysis. Then you're looking at how specific groups or areas diverge from that universal goal. How do subgroups differ from the general population and why? So you're doing a gap analysis. You might be doing GIS mapping. You might be doing disaggregated data analysis. Then you look at and assess what the barriers to achieving the goal for each subgroup is. So whether it's women, whether it's people of color, whether it's Latinos or Blacks, you're looking at what the unique challenges are facing these subgroups and keeping them from reaching the goal. And you might use tools like focus groups and needs assessments and accessibility audits. Then you're looking at crafting targeted approaches for each group to reach the universal goal. So how can policy and program approaches be customized to address specific barriers faced by some while moving everyone towards a goal. And this is what I just talked about in the previous slide about targeted universalism. But the tools that you use in this are best practices. You look at community-driven strategies. You look at culturally relevant policies and practices. And then finally, how do we combine the targeted policy levers with general strategies? And that is targeted universalism. And you want to make sure that you're avoiding strategies that deepen stigma and marginalization, and that you're integrating mechanisms for evaluating movement towards overall goals. So with that, I recognize that I have dramatically eaten into our time. I've talked longer than I planned to. I know that there is a survey that you're supposed to be completing. I would like for you to fill it out so that I can know more about how you view this session. And then I'd like to open it up for questions and answers.
Thank Dr. Rockeymoore-Cummings for joining us today. She's done an awesome job. The survey.
You just went silent. You're muted.
We don't hear you.
All right, thank you. Did you hear me before? Okay, the survey link came to you. I hope you heard me thank Dr. Rockeymoore-Cummings. And we really want to make sure that everybody does that survey. We've got our best turnout actually of our entire series on the line today. And so we just thank people for their interest and for giving up that lunch hour. And so if you'll take that survey link with you, those of you who don't want to stay on for the discussion are free to go on and enjoy your 90-degree wherever you are day. And the rest of us will continue to have a dialogue with Dr. Cummings.